lot. So we have to look at this from a multifaceted process. It's like we want to make sure people are educated about the science. I was a science teacher. I'm a child of a medical professional. I know that there's an important part in education. But then there's the other part that says making sure that things are done equitably.
Right.
And that health is across the board. I had a conversation yesterday, real story. I had a conversation yesterday about a woman here in this town, and she was sharing how her a family member of hers had gone in and was receiving medical care, but they didn't know anything about him. Didn't have a chance to have his papers and everything because he was rushed, obviously. And so being basically categorized and treated as if they were just some random on the street, not knowing who this person was, what their history was, and who they are in the community.
That's really dangerous.
That's really dangerous on multiple levels, because what that again says is that there's bias. Now, we all carry a level of implicit bias that we have to check. We got to check ourselves all the time. But when we're talking with medical professionals, there's no place for bias.
This is very dangerous.
It is life or death to have bias. And granted, if I show up in a medical, blah, 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 8-year-old black woman presents with this. What that does for some people is it says, automatically, I know where this person needs to go.
But here's the thing. This is what's going to mess up a lot of viewers. This conversation we recently had is that the perception is, obviously, if a white person encounters black female 42 that's pregnant, you're going to treat them a certain way. But because this is a systematic, we also see black doctors that fall into the same trap of mistreating people that look just like them. So it's not so much, it's no longer we can say the bias is just on one side or with white people, unfortunately. And I think that's what's really hard to create policies and legislation around. Yeah. Because how do you legislate implicit bias?
And again, and we talked about that a little bit. It's like, okay, how much can you do with the legal system? Of course, you can hold accountability if it's proven that so and so was. For case in point, if someone presents and they are in a huge amount of pain, and they are a black person, is it something that might say, well, they just want some drugs?
Right.
Number one, because, black people, we don't feel pain the same way. So if they're saying my pain level is on 10, well, that doesn't really mean anything. They just want some drugs.
And so I'm so glad you said that, because that's really personal to me. So my children's father suffered from sickle cell for many, many years. Oh, wow. And we know how sickle cell impacts the black bodies, first of all. Yes. And because of his sickle cell, going into crisis was severe pain. Yeah. And so he knew that, and he would go into the doctors and really inform them, like, this is what I need, this is how much I need. Like, he knew his medical treatment because this was so popular for him. This was like what he went through on a daily or weekly basis.
If anyone knew, he knew.
Right. And so the doctors, when he moved to Albany, unfortunately had that sentiment that, oh, you just want drugs. Oh, you're just coming in here because you want narcotics. And you hear many people that are sickle cell patients say they get that same experience of just being dismissed as a drug addict, and you're just coming in here for drugs, when, because their pain is so severe, they really do need higher level narcotics than the rest of us would. So how do we move forward? So your role is big, right? Because you get to be in a position to advocate and to let people know and to hear these stories and to be able to share with legislators like stories about what people are dealing with. This is real life. So it's not just like it's just not us saying.
I promise you, it's not just us saying things. No.
So moving forward, right? So you have a big burden to carry. I don't want to say burden.
No, it is though. It's a burden of the heart.
Yeah, because it's like you get to hear the stories and like the work that you're going to be doing as an advocate. You actually have to really lean into this in terms of hearing the stories and being able to articulate that to leaders. So talk a little bit about some of the things you're going to be doing in your role as Rural Health Equity Director.
Sure thing. Like you mentioned, first of all, I really feel it's a multi-pronged approach. One is hearing real people's stories, real people's testimonies, real people's experiences. This is not something that we're making up. We're not making up things to say that there is a system of lack of equity Whether it's implicit, explicit, doesn't make a difference. It's happening and it's affecting real people. So we need to be listening. So of course, I'll be having listening sessions, opportunities for people to come in a very safe space. I joke around, but I'm so serious. I say where I am, it's a safe space.
Yeah, absolutely.
And the privacy, not disrespecting that, but honoring and giving space for people to share what is so life sometimes traumatizing,
absolutely,
which is life changing, which has such an impact on so many levels.
Mm-hmm.
So having opportunities for people to sit down, stand up, or share.
And
we don't know. We can't go and speak to legislators or to go and speak and partner with other organizations to make systematic changes if we don't actually have the data, if we don't actually have the anecdotal stories, what people have. I went to so-and-so and I experienced this and I felt extremely disrespected and I was trying to advocate for myself, but I didn't have the language. So I felt very patronized and dismissed. And be specific.
Yeah.
I went in with a specific situation that was going on. I had my medical records. I felt very dismissed.
And
these things are real.
And they're happening in this because people, and one of the things I hear so much from people is they don't feel heard. So we're giving them the space to be heard, to be able to tell us what you try to tell your doctors, what you try to tell the nurses. Tell us what happened, and we're going to articulate that to the people that need to hear it.
And that's really important too. And before I move to my next point, I'm going to add to that. We are here in Southwest Georgia. Now, from a nationwide perspective, that carries a little stigma to it. That carries, they're just country. That rural Southwest Georgia, they're ignorant. I'm going to the shadiness of it all. Okay, I just realized that really kind of. Now, these are not my views, but okay.
I'm so glad you said that though, because that's one of the reasons why there's such mistrust.
Yes.
When people, these organizations come to rural communities because they have these preconceived stereotypes about people in the rural South. And so we're looking at them side-eye like, who are you? What are you trying to come do? I don't trust you. And so I think our organization has built a lot of trust that we can actually, people know and trust that we're going to take care of their stories and we're gonna get results. We're gonna go and talk to people and get change for them. So
everything that you said, it's about if someone shares, and we're gonna again have listening sessions, so be on the lookout.
Yes.
When we have listening sessions, if someone comes and they say, listen, this has been such a burden on me. I haven't been able to tell anybody. Yeah. No one believes me when I'm sharing these stories and everything else. It is a safe space. We honor you and your everything that has happened to you.
Right.
We honor that and we make space for you to be able to share that so that we can then take that and amplify it for you to advocate, to be able to say, this is a real life person. Don't judge them because you feel like they're just an uneducated Black person in Southwest Georgia, which I know I have seen here, and
because it's here.
It's here.
Okay. We deny that it's here, but it's here.
Now, mind you, my mango lemonade is the bomb. I'm not just saying that, but it really kind of. I don't know if I'm like saying things shady on purpose. Just saying, not even.
We do, and it's okay. The more shadiness, the more lemonade. It's all great.
No, but
let's
for real,
talk about some of this. Like, what stories are you trying to collect? What do you want people to tell you?
I want people to tell me, first of all, their general medical stories, their general sensations that they feel like I was not heard and I need to be heard. I have this to share. I need changes. I felt like I made a complaint. I felt like it went unanswered. I felt like I did not get fair treatment. So in general, your general health experiences here in Southwest Georgia. Okay. Also, where you've experienced medical debt. Yes. Medical debt is huge. I don't care where you are in the United States of this America.
Why?
Medical debt is the leading cause of bankruptcy here in America.
It is.
It really is.
And it hits your credit report. And so now you can't buy a house, you can't buy a car. It's terrible.
And when we're talking about wealth and equity and like the distribution of wealth, we're talking about Black people being able to come up.
Mobility, right.
Your credit report, and then we get into predatory lending, we get into all this. So your medical debt affects every aspect of your life. Are you able to get an apartment? Are you able to buy a house? Are you able to? You have to get a credit report.
Right. It's a whole other conversation.
It is, but the point is that it's all related because medical debt is real. And when we have seniors, we have young families trying to get up and coming, COVID-related conditions that are still impacting us, people who have pre-existing conditions that were health risk factors that would have made COVID worse.
Not to mention the uninsured, right? So if you're uninsured, you definitely have medical debt. Like you have stacks and stacks and stacks of medical bills.
And we get left with the quandary of, well, do I pay down my medical debt?
Do I pay my rent?
Or do I actually buy food?
Or
do I buy my medicine? Or do I pay down medical debt? Do I pay down medical debt? Or do I put gas in the car and take care of my kids? So we see the snowball effect that medical debt has. So absolutely, we need to hear and listening to your stories will help us be able to take this, bring it up when we're talking about things that are going on in Atlanta, the state legislator that are affecting medical debt and are affecting insurance. This is real life.
Right.
So between general health, medical debt, and of course pregnancy.
And I'm glad you talked about it a little bit because I want to lean into the fact that there's legislators that make these decisions.
Yes.
And a lot of times these legislators are rich.
They have good insurance.
They have great insurance.
They have no medical debt.
Right? And so
their credit report is in the 800s.
All close to these types of issues. No. And so it makes sense why they're not creating policies. And so one of the things we saw during last year's gubernatorial races in Georgia and the 2018, Stacey Abrams was a fierce advocate for Medicaid expansion.
Advocate for real.
Because we know that when there's Medicaid expansion, there's more people that can get coverage that currently aren't eligible, which means that those bills are now getting paid, which means that hospitals stay open. We have
and hospitals are going to get paid regardless.
Yeah, they do. But they're saying that they're having to close because they're not able to pay all the bills. And so this was a fix, right? We had the money to do it. And this could have happened. But unfortunately, we won't see that, at least not in the way in which we were hoping to see it.
Exactly.
And I know there is like the Pathways program where they're going to
which is problematic in many ways.
Why is it problematic?
It's problematic in many ways because of the fact that when you are having as a requirement to say you must work or you must be in school.
And you have to report.
And you have to report. Now, on multiple levels, okay, on the surface, it makes, hey, you know what? Sure, you have a vested interest in your own health. You have a vested interest in making sure that you're being a contributor, contributing to the system. I get that. But that's not the way it really works.
And that should not be a prerequisite to people
that's not the way it really
to
works.
get healthcare.
That's not the way it works. Yeah. In the real world, and I mean the world, we have universal healthcare. We have healthcare that is applied across the board.
And there's countries in the world that have healthcare, whether you have a job or not. It's what your country provides to you. So in the most developed country in the world, why don't we have
most developed?
And so I gotta say,
I was getting ready to say, I felt that.
This is why y'all need to vote, right? This is why you have to vote for people and vote for listen to what they're saying when they're campaigning. Ask these questions.
Ask the questions.
What are you doing about my insurance costs? What are you doing about healthcare costs? What are you gonna do for me? When you get in this seat? And so that's why we gotta vote, y'all. I gotta take a sip.
And while she's sipping, I'm gonna say this too. One of the problematic things about Pathways, it doesn't take into account a multitude of situations. Right. If I am a mother and I am working or I'm trying to manage my children, I'm trying to manage life, I'm trying to do this, that, but to say that I have to report X amount of hours. Now, number one, the way it's actually set up administratively is problematic. Because by the time I report something, theoretically, and if I don't report it by a certain time, which might not be my fault.
Right.
It might be my employer's issue, whatever. So Pathways does not deal with the real life crisis that a lot of Americans here in Georgia are dealing with. And that is low wages. So if I had, I'm trying to work so I can make my work requirements, a lower wage job that puts me in a category financially that might end up, I'm dealing with life. It might end up that I end up losing the coverage, but then I only have a part-time job or I have a low-wage job. And I mean, here in Albany, that is, as I just get general information,